Hi everyone, it's Margaret Wallis-Duffy and welcome to PHAMCAST. You know how much I love getting out into the community, and today this is extra special because it's in my hometown and even better, in my neighborhood. Today we are on location at Young's Pharmacy. It really has been a go-to resource in this community for over 60 years. But today it's even more special because we brought PHAM on the road into Young's Pharmacy for the first ever Osteo REMS bone scan in a pharmacy in Canada. I can't think of a more exciting and important place to do that than in my hometown, in a pharmacy that I trust and one that is really entrenched in education, in community, and in prevention. And you know, here at PHAMCAST, that's what we're all about. So I'm really excited to introduce all of you today to the pharmacist here at Young's Pharmacy. He's also the owner, Peter Hanna. Welcome to the show.
Thank you for coming.
You know, Peter, I have been in this community for almost 20 years, and I have done a tremendous amount of work here at Young's Pharmacy. Your pharmacy has helped many of my family members, my father, rest his soul, my mom, my husband, my mother-in-law, many of my patients. When I came to you, and we just met recently because there was a previous owner to you.
Yeah.
And I'd done a lot of work with them, but what really stood out to me was how immediately you were open to listening to not only new technology, this new Health Canada approved REMS technology for bone health analysis, but you were willing to say, hey, let's talk more about this, and in short order, we're here in your pharmacy. Can you speak to you as a pharmacist and your team here at Young's? Why is this kind of thing important to you?
Well, first of all, thanks for coming and hosting the clinic here. I think it's important that we have to look at everything as a whole, and in terms of, it's just not medication. It's, it's complementary when you have into prevention, different ways to avoid situations, how to diagnose early so that you're not finding things at the last minute, right? So I think it's a whole process we have to look at, and not just one or two things. And I think I'm open to different things out there that would make it make patients and customers and clients, everybody aware of what's out there.
Did you hear what this pharmacist just said? This is a pharmacist, and he said it's not just about medications. Medications play a really important role in musculoskeletal health and in osteoporosis management and prevention. But you heard it from a pharmacist. There is a change in the way this healthcare system is thinking and what this movement is doing. And that is, just like Peter so eloquently said, it is a better together as one integrative approach with prevention. And this is what I love about what you do here at Young's Pharmacy. You really do look at the whole person, and really pharmacy is one of it. But when you walk around this store, you offer so much. Can you talk a little bit about all the things you offer here at Young's? And then we'll get back to some of the bone health.
Yeah, so I always tell people we're not just a typical dispensary. We do a lot more than that. So Young's Pharmacy and Home Care, as you were saying, has been around for over 60 years. And of course, our bread and butter is the pharmacy, but we've taken that to another level. We've built a home healthcare section, and part of that section is a mobility department. So, and part of that is how do we assist patients to stay home comfortably in their home? What aids do they need so that they're not having to go to a long-term care facility, right? And how to make the families feel comfortable that their loved ones are home and safe, right? So whether it's a grab bar, whether it's a mobility, whether it's a rollator, whether it's a scooter, whether it's devices to alert others if, God forbid, someone falls, right? So how do we have that environment set up? We're also part of the team, and we also have a CPAP clinic, so we assist those in the community who need it. We have a lot of ostomy supplies, first aid, bracing. We do a lot of home healthcare stuff in addition to the pharmacy. But we also do something with medications, is where we're involved as well in the dispensing of certain medications that we actually administer. So especially with today's topic, whether it's Prolia or any of the injections, we actually have nurses on staff and pharmacists who not only look at the blood work to make sure that calcium levels are good, and we do the injections as well. So it's like a whole approach of everything together.
Right. Well, what I love about this conversation, Peter, and your willingness to learn and grow from one another, you know that I never use the word alternative medicine. I love to learn from my colleagues in allopathic medicine as they will learn from me. And Peter was open to hearing about the REMS bone scan because, unlike DEXA, the REMS looks at bone density and bone quality. And the latest research is strongly saying and pointing towards the fact that it's bone quality that's a better predictor of whether someone will fracture, not just your T-score, that bone mineral density. And so by having REMS early on, non-invasive, no radiation, more accurate than DEXA, and you're getting that bone density and bone quality, one might realize maybe they don't need something like Prolia, because with these medications, and I'd like you to speak to this, there's a time and a place, and I'm not saying we're against pharma here at all, but they shouldn't always be the front line of defense, and I know you believe that. And if someone, for example, is taking these medications, they should understand some of the side effects and the actions of this medication. Now that you know a lot more about bone quality and the research supporting it and how this REMS plays a role, can you speak to a little bit about, these medications and the mechanism by which they work so people can make more informed decisions?
Well, usually first-line treatment in osteoporosis or osteopenia, you got calcium and vitamin D, and then if there's a need for medication, bisphosphonates, so they help they're anti-resorptive medications, so they actually help the bones with growth, because there's also a balance. And osteoclast, osteoblast. What that means by a term, some help the bones actually get stronger and actually grow, and some you're taking away from them. So the more they take away, the more fragile the bones become and easier for fracture. So bisphosphonates have been around for a while. They do have certain conditions, like certain ways you got to take them properly so you avoid side effects. Lots of water, things like that, depends on which one you take. And then if some doctors, or depends on the scores, will go straight to the new medication, which is Prolia or Disonum, and that is by injection given every 6 months.
Right.
So those are the main two courses. Plus, there's a big plus to that is there a good diet? Is there good calcium and vitamin D intake? Is there any resistance training or weight training exercises? Is the patient mobile enough to go for walks regularly? Because you also need to strengthen the bones, not just grow them, but you make them stronger.
Absolutely, and the mechanism, and I'm not going to pretend to be a pharmacist, but from my work in musculoskeletal health for many years and the learning I've done a lot through my work with the REMS bone scan over the last 3 years, you have osteoblasts that build bone and osteoclasts that take away the old bone, and the mechanism of the drugs are taking away that osteoclast.
Yeah, they're blocking it so that
Correct.
You're not having that, and you're having other balance where the actual growth happens more than
Right, but what's interesting about REMS is that, unlike DEXA, we can now look at not just how much bone you have, because we can build up bone, but if the bone is old and brittle, but we now have a way to look at the quality and the strength of bone and that fragility score, which is a game changer.
Absolutely.
Because you can have low bone density, a T-score that's low, and theoretically you're going to be diagnosed with osteoporosis the minute you have a minus 2.5 T-score. However, if the bone quality is strong, because you have a good lifestyle, to your point, Peter, you eat lots of protein, you do resistance training, you're taking your vitamin D, vitamin K2, magnesium, getting enough calcium in your diet, making sure you're looking at gut health and sleep and all of the things, you can have low bone density and good bone quality and have a low fragility score. That's the game-changing nature of this technology and the research, by the way, to support it. And this is why I love, and OsteoSound is always evidence-based and working collectively, why we're so thrilled that you were open to learning about this as a pharmacist and inviting us here to do a scan, because there may be some people that don't require these meds, but you will know to talk about the REMS bone scan and also to encourage them to do the lifestyle things. Because I think it's in our culture, if we often we think if we take a medication, then we get to holiday and not do anything. That's not good for bone health.
No, I think it's important to be aware of what's out there and to understand what are we looking for, what are we testing, what is our goal, what do we want for quality.
Yeah, absolutely.
Yeah.
And that's why, being the first pharmacy in Canada to bring this is such an honor, and I'm so excited that we could do it here. And I know that we're going to be speaking to more of your team. We're going to be looking at all of the mobility and safety tools that you have here at this pharmacy. Is there anything else you'd like everybody to know about Young's and your commitment to community and also keeping people living well with health span? Anything else you'd like to add?
I think what I love about a small town, or not a small town as we used, but a community that, like a pharmacy that's integrated with the community. It's not just about, here's your script, see you later. It's being aware of the families, the situations they go through, and then being able to use the whole team. So for example, I understand, this is going on, this is medication, but you could also benefit from X, Y, and Z, whether it's a product, something in home care mobility, whether it's a service we know we could refer you to, someone who can go into it further. Like it varies across the board, from diabetic educators to nurses, right? So there's a lot of other stuff to kind of complete, because we know the healthcare system is under so much strain.
Indeed.
And there's a lot of gaps, and a lot of people seem to be falling through the gaps. So
yes.
It's good for sometimes they come, we can guide them and say, we go see that person, or so and so can help with this situation if it's not something you can, easily access.
Yes, and I understand you also just opened, Dr. Puna's in here.
Yes.
You've got a doctor's clinic that is also here in the pharmacy, which is phenomenal. And I just commend you for the work you're doing and continuing to do in terms of community education, and also being a champion for preventative health. This is really important timing, and it's also very important to the future of healthcare in this country.
For sure.
And working better together is really the way forward.
No, we're hoping to bring on more doctors or nurse practitioners to kind of have that whole collaboration together,
Yes.
all on site. So we can administer medication, you can see a physician, you can get a product, if you need a referral for a sleep apnea or CPAP. There's a lot going on, and we would like
Yes.
to have that whole health team together.
Yeah, and you can have a pop-up REMS bone scan here in a pharmacy because you are open to the idea
Absolutely.
of it. And that's how legacy change in healthcare happens. The willingness, the curiosity, and the willingness to work better together for the benefit of the patient.
I absolutely think at the end of the day it's all about the patient, and I know some
Absolutely.
patients can't advocate for themselves.
That's right.
They struggle navigating the system, so I encourage them, if there's an issue, we always try to help them navigate it, tell them what's out there, and then they can make an informed decision on what path they want to take.
It's fantastic. Well, thank you so much.
thank
We can't
you.
wait to meet the rest of your team, and thanks for hosting us for the first ever
No,
REMS
you're
bone
welcome.
scan.
Hopefully more to come.
You betcha.